Hi,
Hi, my name is Andrea. I'll be your student nurse today. So, what's your name and date of birth?
J.Q. Thomas, 11/12/78.
Perfect. So, patient identification is done. I'm going to wash my hands and pull the curtain for privacy. Today, we're going to be doing a head to toe assessment to look at the general health of your whole body. First, I'll start with some questions, then do an assessment of your head, your chest, your abdomen, and your extremity muscles. So, the questions are, have you had any changes in your taste or smell?
No,
Great, so that was cranial nerve number 1. Next is questions about pain. Have you had any sensations of pain lately?
just a little lower back pain.
Lower back pain, and then how often does that come on?
Just every other day.
Every other day about? And then is there anything that brings it on or anything that helps alleviate it?
I think let's just wake up in the morning stiff and a couple of stretches and I'm fine.
Okay, so some stiffness when you sleep, but action helps movement. Okay, and then on a scale of 1 to 10, how would you describe your pain, with 10 being the worst?
How about a 6?
About a 6. And then how would you describe that pain as such like aching, dull, stabbing?
That's a dull
A
pain.
dull pain. And does it radiate anywhere else in your body?
No,
Is this familiar? Have you felt this before, or is it a new sensation?
it's come and go over the years.
Come and go over the years. Have you talked to your doctor about it before?
Yes,
Okay, so doctor is familiar with it, but it's a good thing to mention.
yes.
Okay, great. I'll pass that along to your doctor. And the next thing I'll do is start with your head. So I'm going to inspect your head and look at the colors. The skin tone is nice and even, no redness, no abrasions. So I'm going to palpate now. So palpating your head to feel for roundness, no bulges, nice muscle tone on your neck. I'm going to feel for your carotid artery, one side, and then I'm going to feel for the other. And those are nice and strong. Now I'm going to feel around your ears. So feel the lymph nodes. Is there any tenderness there?
No,
And what about tenderness around your eyes?
no.
No tenderness. Perfect. And inspecting your ears, there's no abrasions. They're nice and clean. Your overall body appearance is clean. You're present. You've been answering my questions, so that's also a great thing. And now I'm going to move on to cranial nerve number 11. So if you could shrug your shoulders. Okay, and then push my hand away. And the other way. Cranial nerve 11 checks out. And now I'm going to move on to the eyes. So that's cranial nerve 2, 3, 4, and 6. So first I'm going to see, stare at my finger, and now tell me how many fingers I'm holding up.
2,
And what about over here?
3.
Okay, so the peripheral works. Now follow my finger as I move it up and down. Great. And now I'm going to look close and away, and your pupils accommodated. Now I'm going to use a pen light and look at your pupils a little bit more detail. So again, just look straight forward, and your pupils are equal and round, and they react to light. So that's great. Now I'm going to move on to your oral cavity. So that was cranial nerves 2, 3, 4, and 6. Now I'm going to move on to your oral cavity. So go ahead and stick your tongue out. And I'm going to inspect, and all the skin is red and moist, no sores or abscesses. And then if you could stick your tongue to the left and right. Okay, and then swallow for me. Perfect. That was cranial nerves 9, 10, and 12. And now I'm going to look at cranial nerves 5 and 7. So first, clench your jaw and a strong muscle tone for cranial nerve 5. Cranial nerve 7, smile and frown and puff out your cheeks. And now for the sensory aspect, I'm going to ask you to close your eyes once again and tell me if you feel this, which is a pokey feeling, versus this, which is a soft feeling. And tell me where on your face you're feeling it.
Left pokey, right soft, top pokey, bottom soft.
Perfect. Thank you. So we went over all of the cranial nerves now. You're responding to my questions, so that means you could hear, which is cranial nerve 8. And now we'll move on to the chest assessment. So if you could remove your shirt, I'm going to first listen to your lungs on the back. And overall inspection, your skin has a nice contour, it's intact, and an even tone. Now I'm going to listen to your lungs. So go ahead and take a deep breath every time I move my stethoscope. And out. an S pattern down his back on either side. And 6 points on the back, and then also a point on the right side to listen to the third lobe. And all of your lung sounds nice and clear, no crackles, no wheezing. So go ahead and turn around once more, and I'm going to listen to your heart sounds. So on inspection, your chest looks intact, even tone, no pulsations. Now I'm going to listen. And first with the aortic valve, where S2 is louder than the S1, and go ahead and just breathe normally, try to relax. Pulmonic valve, S2 is louder than S1. Tricuspid valve, S1 is louder than S2, and mitral valve, S1 is louder than S2. I'm going to flip my stethoscope around and listen with the bell now. And the mitral valve, tricuspid, stop at the Erb's point, listen for murmurs. And then the pulmonic and the aortic. Perfect. So listen to your heart. Everything sounds nice and clear. You can hear all of the pulses, the heart rates there. And now I'm going to move on to other aspects of the cardiac system, which are capillary refill. So in your hands, push on your nail, turns pink right away. Your radial pulse. Strong, even, +2 pulse. Your pedal pulse. And again, matches your radial pulse, strong and even, around a +2. And no edema in your ankles either, so that's great. So your body is getting lots of oxygen through the blood, and your heart is strong, pumping all of the blood around your body. Now I'm going to do a GI assessment, so go ahead and lay down. And I'm going to inspect first. Again, no palpations no pulsations in your abdomen. Skin is intact, good contour. And now I'm going to auscultate and listen to 2 points in each quadrant, listening for 5 to 15 seconds at each spot, and listening for 5 to 30 digestive sounds each minute. And now after the auscultation, I am going to palpate and do a light palpation in each quadrant. Any tenderness with that?
No.
Okay, and then a deeper palpation at 2 spots in each quadrant. And feel free to let me know if there's any tenderness. Hopefully this is more of just a massage for you. And now the last inspection I'm going to do is for rebound tenderness. So take a deep breath in and out. And as I release my fingers, do you feel any tenderness?
No.
Okay, perfect. So go ahead and sit back up. We're almost done with the assessment. The next is going to be sensory and motor for your extremities. So put your arms out like this, and then push up, and push out, and down, and in. Perfect. And do you feel this?
Yes.
Okay, perfect. I'm going to do the same thing on your legs. So push up, and push out, push in, and push down. And do you feel this?
Yes.
Great. So there's good motory and sensory perception in both and all of the extremities, and everything else is checked out just fine. So it seems like you are in very good health. Do you have any questions?
No, I do not.
Okay, perfect. Well, I'll let the doctor know that you are feeling some pain in your back, and then they will go from there. Okay, hope you have a great day.
Thank you.
Bye. So we went a little bit fast because I wanted to make sure it was under 10 minutes. I could have done a little bit more of some patient rapport and explaining what was going on. I like to also connect with the patient as far as like why that wouldn't be important, or encourage them on their health, congratulate them on their health. Yeah, I think I did pretty well. You know, I did the hand washing. Probably could have asked a little bit more about the pain. I know I did the general survey after I started doing some of the cranial assessments, so I caught myself, but I did not do that as a general, I was making the assessments early on, like right when I saw the patient, but I didn't verbalize it. And looked at the cranial nerves, the range of motion, palpating the ears. I tried to also do like the sound on the ears, but although just him describing or like answering the questions is helpful. Perla did it like in a different order than I usually do, so definitely nervous of the video, but I did not inspect the sclera and the conjunctive of eyes, so that's something I could do better. Did the oral cavity, and I didn't actually say anything about the midline in the mouth, so I could have definitely done that. So talking about like the uvula and the tongue at the midline. I did the pedal pulse and the edema and all the sounds I did with the bell, the stethoscope. Yeah, I did the contour, the assessment, the palpations of the abdomen. Oh, I didn't do a balance test, so I could have had him stand up and do a balance test. That's something I often forget. I know that's part of cranial nerve 8, so listening to the sounds is part, but then also the balance is a really important part as well. So overall, I was trying to get under 10 minutes, what I've been having a struggle with, so I think that was the hardest thing for me. But otherwise, I feel like I did fairly well with like the pain assessment. Looking at the sclera and the pink of the eye was again something I could have done better, and the balance test are the two aspects that I missed. So thanks for watching the assessment, and thank you for being such a good patient. All right, see you in class.